Hello, this is Dr. Stanley Lang, and this broadcast is on the topic of anxiety and depression and the connection with the gut. And also, the main point of this is the connection with probiotics. So I'd like to tell you a story of a patient that I saw recently that illustrates this reality in a very profound way. This is a patient I've been taking care of for quite a long time. She has a variety of different medical conditions that I've treated over the years, but two of them have been consistent. One is anxiety, often with panic attacks. The other symptom is depression. And she's been on medication for both of these problems because at times they have been quite severe. And so she sort of turned a corner a few months ago and really wanted to understand how could she approach her life in a healthier way, because she was starting to get more and more things going wrong, and she realized she was getting a little bit older, and she was realizing that her body's ability to self-repair or to withstand the stresses of her usual work just wasn't there anymore. And so she was starting to actually get worried about what was going on, even though she's still quite young, at least compared to me. And so we talked about 3 to 4 months ago, about the use of probiotics as a strategy because of how the GI tract is so intimately connected to brain health. Now, in other videos, I've talked at length about the connection between the GI tract and brain health. But just to kind of briefly summarize, the brain has a connection to all of the organs through a nerve called the vagus nerve, and our organs are supposed to talk back to the brain through that same nerve. But the GI tract is a little bit unique because the way that it talks back to the brain is pretty much governed by the health of the bacteria that live in the GI tract. Now, we talked about the different options. She could take probiotic capsules, or she could take certain probiotic foods that I recommend. And so she decided to do this, to take the foods and in the particular strategy that I recommended. And so over the next 3 months, her need for both of the medications that she has taken for anxiety and depression for some time has completely gone away. She was actually off of the medicine. She had discontinued them herself because she didn't need them anymore. And in addition to that, her heartburn symptoms had completely gone away. Now, why would that be? Well, because the GI tract is so much damaged by chemicals in our environment that largely come from the foods we eat, and especially a chemical that is an herbicide called glyphosate. Because of this damage that's going on all the time, if we don't do something to repair it on a regular basis, and I think it should be daily basis, then we're going to be out of balance in terms of the GI tract communicating with the brain. And when it's not communicating well, the brain says we're in chronic stress. So just by having the gut not healthy puts you into chronic stress, whether you feel stressed or not. And the brain is reacting as if you're in chronic stress. And it's kind of like the equivalent of setting off alarm bells, setting up the fire department, setting up the police department. That's the stress response. And when the brain and the body is occupied with that kind of stuff, it's not occupied with fixing itself. So lots of things start to go wrong. The immune system doesn't work right. So the long and the short of it is that she is well on the way to fixing multiple different things in her body just by getting her immune system right. Now, we've also focused a lot on the key role of proper nutrition, which is obviously connected to getting the GI tract right, and nutritional supplements, which is also a big part of the whole process. But if she hadn't started this part of the process, a major cornerstone would have been missing. So this is a really good example of the connection between body, mind, with the sort of the foundation of the body being the GI tract. So it's a really good demonstration of a whole person health approach that I like to talk about, with health of body, mind, and spirit being the best way that we can achieve the best degree of health. And I'd like to give you access to a free video report on this strategy of probiotic-based foods that I've been recommending for some time for my patients. I think it works way, way better than any kind of probiotic capsules. And I'd like to give you that video report just clicking on the link below this video, and it'll give you access to that. So I wish you well in your health. I'm not trying to say that just taking some probiotics will make your anxiety and your depression go completely away, because it may not. There may be other issues going on, but it's interesting that in this particular patient who I've been treating for a long time, it completely went away in 3 months, and I hadn't done anything different as far as other advice that I've been giving her for a long time. So for many people, getting this part right decreases stress, and they feel a lot better. So it's definitely part of the picture in terms of you recovering from anxiety and depression. There are other things, as I mentioned, but it's part of the picture. So I encourage you to pick up that report, that video report. I wish you all God bless and have a great day.